command from our COOP 565-32709. There are 8 audience members present. Snap, Crackle, and Pop. 3 fun-loving characters commonly associated with cereal. But what happens if something else goes snap, crackle, or pop? We all know someone who has broken a bone in their life. Maybe you're like me and have had several occasions when you should have broken something. According to WebMD, a site with articles posted and reviewed by doctors, it states that the average person breaks 2 bones in their lifetime. Today, we'll first snap out what a bone fracture really is and the 2 types of bone fractures. Then, we'll take a crack at the healing process of a bone fracture. And finally, we'll pop in the 2 main treatments for a bone fracture. Bone fractures are something that everyone with a skeleton has to face. In the Merck Manual of Medical Information, the second home edition, published in 2003, it states that a fracture is a break in a bone, usually accompanied by an injury to the surrounding tissue. MedicineNet.com, a professional site that provides medical knowledge to the public, followed up that definition by adding, when outside forces are applied to the bone, it has the potential to fail. Thus, a bone fracture cannot support itself against an outside force. There are many types of bone fractures, but in the interest of time today, we'll look at the 2 main types. A fracture is either simple or compound. Simple fractures do not break through the skin. Because of this, they're also called closed fractures. In a simple fracture, the bone can either be broken completely through or only partially cracked. On the other hand, if a bone fracture breaks through the skin, it's called a compound fracture. Because of this, they're also known as open fractures. Compound fractures are more severe than simple fractures because they open the body up and risk infection. As the doctors are diagnosing the different types of fractures that have occurred, the body is already beginning to heal it. According to the article, Bone Healing Processes, from Medscape.com, a branch of WebMD, there are 3 stages to the bone healing process. Stage 1 is the inflammatory stage. As the bone breaks, the blood vessels within it also break. This causes bruising. So to stop the bleeding in the fracture, a blood clot called a hematoma forms. The second stage is called the repair stage. It has 2 parts. In the first part, the bone cells replace the hematoma with a cartilaginous callus. In the second part, the cartilaginous callus is replaced with a bony callus. This stage takes 3 to 6 weeks. This is the stage the doctors are most concerned with keeping stable to allow the calluses to form. In the final stage, called the remodeling stage, the bony callus is replaced over time with compact bone. The total healing time for a fracture is about 3 to 18 months. As I have just shown, the body heals itself, so the treatment of a fracture is only to make sure it heals properly. It's not like medication that just makes the illness go away. It makes sure that the bone is put in appropriately. There are many types of treatments to complement each type of fracture. However, the 2 main types of treatment for fractures are either a stabilizer or surgery. There are 3 main types of stabilizers. A splint is the first kind. It has a fiberglass base and usually an elastic wrapping on the outside. The elastic allows it to expand, which allows some room for swelling. The second is an immobilizer. This is used for elbow or shoulder fractures. It wraps the arm to the body to keep it snug. It uses the gravity to keep the fracture in place. And the final is a cast. A cast is like fiberglass base of the splint, only it wraps completely around. It's the hardest and most stable. The second form of stabilizer, or treatment, is surgery. Surgery is used for severe breaks. It's usually used for compound fractures, where the wound on the outside of the compound fracture is to be cleaned and stitched back up. After surgery, a cast or a splint might be used during recovery. These are the 2 most common treatments for fractures. In conclusion, fractures are one of the most among the main problems our bones have to face. So, to sum everything up, we snapped out the two main types of fractures, compound and simple. Then we took a crack at the three stages of the healing cycle. And finally, we popped in the two main treatments for each fracture, a stabilizer or surgery. Now, the next time you know someone who breaks a bone or you break a bone, you will understand more about the type, the healing, and the treatment of that fracture.